COVID-19 data has come at us really at an unbelievable pace, something that has been really incredible to see as someone who covers medicine. What's it been like for you trying to stay on top of all this medicine or all this new data, especially when practicing medicine and it can have such a tangible real world effect?
I think that's a challenge because there's a tremendous amount of information coming. Initially, there was a big rush to publish, and maybe it wasn't as peer reviewed as it should have or could have been. Uh, and I think you need to sort through it. Perfect point. There was a study, a small study came out. Maybe patients' blood types will offer you some degree of protection, against COVID-19. All of a sudden, the phones are ringing, with patients calling about their blood type. And it's just like, I can transfuse their blood and change it. But I think it's important. And there's one common theme, throughout it all. And it doesn't matter on the studies. There was a study came out of, England a few weeks ago showing the use of echocardiography in patients with COVID-19, and more than 55% of patients had an abnormal echocardiogram. So the heart wasn't squeezing as well as it should have been, for whatever reason. So I think this gets us back into a discussion, sorting through the tremendous amount of literature in the cardiovascular arena. Risk factors for heart disease lead to risk for COVID disease. And if you can educate them in COVID, and that'd be a great motivating factor to reduce their cardiovascular risk beyond COVID. So that starts a conversation for some of these patients that have been, how can I say, stonewalled against making improvements in their cardiology. And yes, there's a tremendous amount of reading that goes on and trying to sort it out. And, for taking 3 steps back, it's an amazing scientific experience because you're living and experiencing something that we've never seen in our lifetime. I was in my residency during the AIDS epidemic, and it was a different time, different focus. I think, it's going to be important for us just to take a grain of salt. We didn't know that COVID caused blood clots, for instance. And I was living through this early in March. I give a perfect case point. We had a 35-year-old healthy police officer came in, a little shortness of breath. And at that time, it was early March, so we weren't overwhelmed. His chest x-ray looked a little funky on both sides, both lungs. And the ER had the time to do a CAT scan. So they did a CAT scan and they diagnosed him with bilateral blood clots in his lungs. So as March had gone on, we didn't know that COVID caused an increased degree of blood clots. And we kind of, across the medical profession, came across this, as we're seeing more and more patients having blood clots and, difficulty managing them on the ventilators. So, that was an important finding, and disseminating that information became very important because now, as standard of care, patients come to the emergency room, COVID positive, they get tested for D-dimer to look at their blood clotting risk. So that's an important thing. So I think sorting through the information with a grain of salt is very important, and having a discerning eye for what's applicable to your practice and evaluating your patients and treating your patients. I think it's also important to know that patients that are COVID positive, in one study in New York cohort, only 1/3 of patients had a fever. So they were COVID positive, but only 1/3 had a fever. Now fast forward, they want to have arena events, they want to have Broadway events, they want to take your temperature at the door. You might be seeing this in the sporting bubbles they're creating. Maybe they're just taking temperatures and not swabbing as vigorously as they will do during a season, but patients or players are coming down with COVID. So, again, take a step back. If only 1/3 or so have a fever and COVID, that's problematic because 2/3 are, going through your screening process. And then there's about 40% or so more COVID patients that are asymptomatic. So that's the bundle we have here. And it's very important to be a discerning physician and communicate with your patients, listen to all their signs and symptoms, and make your best best evaluation.